Hello. In this episode, we have the privilege to speaking with Dr. Brian Costello. Dr. Brian Costello is the medical director of Mayo Clinic International Advisory Services, and is one of the key figures in the development of technological innovation in healthcare at Mayo Clinic. Today, we will explore how the collaboration between Hospital Internacional de Colombia, HIC, and Mayo Clinic impact in healthcare in Colombia and across Latin America, particularly in the fields of oncology and cardiology. Dr. Costello will share his experience in the use of innovative technology to enhance patient care, how the collaboration with HIC is integrating these advanced tools, and how this collaboration contributes to rising medical standards at the region. We take a closer look on how technology and the best medical practice can transform healthcare in delivery in Colombia and Latin America, opening up new opportunities for all. Without further, let's begin with some questions, Dr. Costello. Welcome to FCB and welcome to our podcast.
It's great to be back here. Thank you, Dr. Castillo.
Okay, Dr. Costello, as a leader in oncology and medical director of Mayo Clinic International Advisory Service, how do you see this collaboration helping HIC improve care in areas such as cancer treatment?
So first and foremost, we are so excited to be here, our whole team, and myself personally, coming back to visit you at HIC. This is a great occasion, momentous occasion for the future. I think really the way we think about this is we want to lay a foundation. We already have a strong relationship, but our announcement as HIC being a member of the Mayo Clinic Care Network really brings it to a new level. And it brings it to a level that we will grow and grow and grow over the course of years. So really what we want to do initially is do the foundational work that's necessary to understand the underpinnings of HIC, how our relationship can evolve. So really we think about, let's do the initial collaborations and then look at specific service lines like cardiology, like oncology, and see where those synergies are that we can really help and build out from there.
Great. I think it's for us is a really good opportunity. Mayo Clinic is known for his strong focus on technology. How is the collaboration with HIC expected to integrate such innovation to enhance healthcare delivery in Colombia and Latin America?
So I think we have a long history of innovation, as you well know. And we really look at our practice as our laboratory. So there are a lot of tools that we've developed internally at Mayo Clinic that we use within the practice that eventually we can evolve and develop and perfect, if you will, to then bring them to Care Network members. So we have internal e-consults, for example, where we consult with each other on basic cases without the patient having to come in person to see one of us. So we have tools like this to collaborate. I think as those things evolve and other things that we're developing internally, such as digital pathology and other sort of service lines, that then can be rolled out to places like HIC and really have that grow and develop outside of the walls of Mayo Clinic. I'd like to just look back historically a little bit here. If you look at the Mayo brothers, they were great innovators and they were great collaborators outside of Mayo Clinic. They traveled far and wide and they really shared ideas. It was about best practices. They learned from other groups, but they also shared their best practices with groups. So we have lots of examples historically of innovation and collaboration. And so what I really see here is that this is a starting point for evolution in terms of the collaboration with HIC, where we're developing things internally, we're doing our research and development, and then as those things mature, then we can roll those out and enhance them in groups like yours.
Okay, in terms of medical education and professional development, what specific benefits to HIC team gain by working with the Mayo Clinic, particularly regarding to new methodology and clinical practices?
So the HIC team will have available to them many tools that we use internally in my own practice and my colleagues at Mayo Clinic. Number one is Ask Mayo Expert, which are a series of guidelines and specific guidance for certain medical issues. So for example, if I'm seeing somebody in my oncology clinic and they've developed hypothyroidism because of the drugs that I'm giving them for their cancer, I can go to Ask Mayo Expert. It's an online, I can get it on the computer and have an algorithm for how to work that up, how to treat it. And it's really a robust set of guidelines written by Mayo Clinic experts. So it's all written by my colleagues. And so that's one example of the types of things that the IHC physicians and other staff would have access to help in day-to-day clinical practice. In terms of education, there's availability of accessing our grand rounds. We have a robust e-tumor board menu. I participate in the tumor board for my specialty area, and there's lots of great activity and involvement and participation by Care Network members virtually on these e-tumor boards. So this really is a mechanism to help enhance care here. Already incredible facilities, incredible medical staff here. What we look at the Mayo Clinic Care Network as is helping to enhance the already fabulous care that's being given here and therefore benefiting your community.
That sounds great for all the doctors who work at the FCB. Research and clinical trials are essential for advancing in medicine. How can this collaboration drive new research initiatives in oncology and cardiology for HIC?
So that's a great question. I think that's part of the longer vision, in my view, getting the baseline collaboration down, putting the infrastructure in place, and then building upon that. So I see research and education going in many directions. It's going to be a collaborative back and forth about exactly how that looks. For example, in terms of clinical trials for cancer care, which is something I do a lot of myself, it requires a very robust infrastructure and expertise. So part of that, in my view, would be making sure you have the right infrastructure, the right people, not just physicians, but the right support staff to learn how to do clinical trials effectively, efficiently, and in an expert way to bring that kind of care to your patients.
Mayo Clinic has developed a successful model in the organization of oncology and cardiovascular care. Which of this experience do you believe could be adapted to HIC context and strengthen comprehensive patient care?
So, kind of dovetailing on my last answer, I think that getting the proper infrastructure is important, and making sure the clinical services are there to build upon. So we talk about our three shields at Mayo Clinic: clinical practice, research, and education. We both have the three shields on our ties today, proudly so. And the reality is that I look at our clinical practice as our laboratory and our clinical practice as our classroom. So we have to make sure that all the infrastructure in the clinical practice is there to build research and education. I was telling a story to the team this morning about a wonderful colleague, a non-physician colleague, who retired from Mayo Clinic 2 weeks ago. She spent her whole career in our department as a clinical research coordinator and eventually became the head of our clinical research coordinator staff. She had incredible knowledge, and she retired after 48 years. And what I told her, I became very close to her, I told her that not only did she touch the lives of patients personally, but she educated people like me as a fellow and as a junior faculty and many, many other physicians about how to do clinical trials, about how to implement them, about how to do them safely, about how to take care of patients on a clinical trial. And so she has probably touched at least thousands and thousands of lives, if not tens of thousands of lives in a 48-year career. So what we're talking about is it's not just about the physicians, not just about the nurses. It's about everybody on your medical staff coming together to bring to bear their expertise for patients. And as you and I have talked many times, the patient is at the center of everything we do at Mayo Clinic and in your institution, and that's inspiring. And so I think if we keep those things as our guiding light, the patients, our values, and the model of care of an integrated practice where we have mutual respect, everybody has a voice, everybody works together for one common purpose, then this develops into something greater than any individual person, and that's inspiring.
Great. I think is for HIC and the department is a very big opportunity to implement it. At Mayo Clinic, technology is integrated through the clinical workflow. Which digital tools or clinical decision support system do you consider that a priority to adapt to at HIC in order to improve diagnostic accuracy or care efficiency?
So I'd have a few comments about that. And some of it doesn't relate to technology, but we'll talk about the technology first. That certainly there are things that are coming into our practice, again, being developed internally that make things more efficient for us and make diagnostic accuracy better. So these are things as an oncologist that are going on in the laboratory or things that are going on in radiology that I really find important, because if I don't have the proper diagnosis based on imaging and pathology, I can't get off the starting line, if you will, for therapeutics. So again, some of the internal innovation that we're doing in terms of digital pathology, the big future, as you know, is AI and how that helps us better in diagnosing. I can tell you we have some homegrown internal things that help the clinician day to day, one of which is something called record time, which is because we're a referral practice, many times we will have many outside medical records and we're seeing somebody for a second opinion. This is a tool that will digest all of the outside medical records into key information for the clinician and present it to us in a way that isn't perfect, but it's enough that it's a reasonable amount for us to review before seeing the patient. So these are the kind of innovations technologically that I think are really going to help and make us more efficient. I would say, getting back to our roots, we keep the Mayo model of care at the forefront of everything we do. And that means that we collaborate, again, mutual respect. We work as teams because we work better when we all put our heads together for a patient and think through the problem, especially in complex situations. The other thing is I'd like to say is that we do something that costs no money. It costs $0, but is very powerful. And that's that we talk to each other. I talk to colleagues every day that I'm working in the clinic or the hospital, multiple colleagues. I talk to pathologists, radiologists, surgeons. That's part of our culture, is to collaborate and to talk to each other. So no matter how great the technology becomes, if we lose the Mayo model of care, if we lose the values as our guiding light, and if we lose talking to each other, we don't have anything. So we need to keep all of those things as our basis and build the technology based off of our culture.
Dr. Costello, at the end, what do you want to tell to FCD worker and the community about this relationship between Mayo Clinic and HIC, and how is this opportunity for us, for Latin America, for Colombia, to improve the quality of care? What is your feeling, your recommendation about this marvelous agreement?
Yeah. So I have a number of comments about that, and I'll put those together in no certain order. But number one, we are so thrilled to be here and joining in this collaboration with HIC through the Mayo Clinic Care Network. What I want to assure the people, both who work here but also in your community, that we are very selective about who we invite, if you will, to join the Mayo Clinic Care Network, especially our international collaborators. So one thing that I want people to know is that you have gone through a very detailed due diligence and vetting process to get to this day. So they should be very proud of what you've done, and you should be very proud of what you've done. And I know your history, and we've talked. It's based on values, it's based on putting the patient at the center, and you have built something incredible here in Bucaramanga. We want to help even elevate that further through this collaboration. So that's number one. I think that what our goal is to really help elevate care in your community and help your medical staff even enhance their skills even further. So what I see in the future is, again, a bi-directional discussion of how do we need to enhance things more? What service lines do we need to enhance? How do we better help and heal patients in this community and in Colombia? Because no doubt you already have a referral-based practice. Once your reputation continues to grow and grow, you will have much more referral-based practice. And that is a good thing for Colombia. It's a good thing for Bucaramanga. It's a good thing for your institution. And I will say, as somebody who's worked at Mayo Clinic my entire career, it is so invigorating to be part of something that's so much bigger than yourself. And that's what I see here for the future.
Okay, Dr. Costello, really it's my pleasure to have this conversation with you. And it's my pleasure to have a Mayo Clinic Network in Bucaramanga with collaboration with the HIC and FCB. I think it's the best opportunity to improve the quality of care in all our patients and to take care in the better today. Please accept my thanks. And I am very happy to have you here in Bucaramanga.
Thank you, Dr. Castillo. It's been a pleasure. And it's our honor to be here.
Thank you.
Yeah.